Hi, my name is KT Overbey, and I'm the President and Executive Director of OneSight. Today, I'd like to introduce you to our organization and give you some information about the work we do and why it's so important. For the past 30 years, OneSight has been committed to bringing high quality eye exams and glasses to people who have no other way to get them. I want to pause for a moment and talk about that. Lack of access to vision care is not the first thing many people think about. We all know that there are many pressing issues in the realm of global health, all of which are important. But this is one that is eminently solvable. And it's also one that has an enormous ripple effect on so many different aspects of people's lives. And yet, access to vision care is not a topic that many people think about. For many people around the world, you either can see fine or you can't. And if you have a vision problem, many people will simply make an appointment with an optometrist to get it taken care of. And yet, for 1 in 7 people on our planet who need glasses, that is not an option. They simply have no way to get them. And just so I'm clear, when I say 1 in 7 people around the globe, that's 1.1 billion people. So why can't they get glasses? We call this the 3 A's. The first A is awareness. People don't know that there's a problem with their eyes. They think this is just the way the world looks. Or if they do know, they don't think there's anything that can be done about it. The second A is lack of physical access, meaning there's no one who can provide care or glasses, or if there is, the wait times make it prohibited. And in times of disaster relief, this can be especially true. And finally, vision care may not be affordable, which is the third A. And the impact of not being able to get vision care has far-reaching effects, touching on some of the biggest issues facing our world today. When you think about issues of gender equality, women are more likely to be visually impaired, and women and girls are less likely to get their vision issues corrected, especially in the developing world. When we talk about education and the impact it has on overall development, if a child can't see well, the investments made on education will have minimal impact. Even in the broad challenges of poverty and economic health, not being able to see clearly is a big hurdle. So to sum up our work, we like to think of it in 3 core categories. We change lives through helping people who can't see clearly get the glasses they need. We change communities through our long-term self-sustaining vision centers that create access at scale for millions around the world. And we change hearts through the power of our programming, whether it's a volunteer on the clinic or a sponsor, or even our donors who make the choice to support our work here and abroad. All of that from a simple pair of glasses. We change lives through helping people who can't see clearly get the glasses they need through charitable clinics. These usually last a week or so, and we run these all around the world as well as across the US. During these clinics, we offer free eye exams and glasses made right on site to provide instant relief to those who are living in a blurry world. And the benefits are very real. Right now in the US, 1 in 4 school-aged children has an undiagnosed vision correction need. That's 25% of the most vulnerable among us. And it's robbing them of their potential. Studies have shown that up to 80% of how we approach learning in this country is visual, and that students who get glasses can do up to twice as well in school. We hear it all the time. Kids who were labeled as having learning disabilities or behavioral problems were just not able to see the board. Once they get glasses, they're more engaged. Now, the benefits of clear sight for adults are also very compelling. Working age adults who have clear sight are able to earn up to 20% more and be 35% more productive. They can keep their skills relevant. They can provide more for their families. Think about that for a second. A simple pair of glasses can have an enormous impact on our world. I always say this is about so much more than giving someone a pair of glasses. It is truly about enabling them to learn, support their families, and I believe it contributes to breaking the cycle of poverty in many cases. These clinics are also a way to respond to urgent needs as they arise around the world. Just a couple of years ago, we were able to serve refugees from Syria, Iraq, and Palestine who were displaced from their home by war. We also are engaged in ongoing work in Thailand to help migrant and refugee families along the border with Myanmar. And on the other side of that country, we've also recently begun providing care in Cox's Bazar in Bangladesh to serve the needs of the thousands of Rohingya who are living there. Beyond changing the lives of individuals, we also create change for whole communities, helping them build their own self-sustaining solutions that don't rely on organizations like OneSight to keep going. Yes, we help get them started, but ultimately, they own it. And that's exactly what we do with our sustainable programming. We've had the privilege to work closely with governments and partners around the world to develop permanent self-sustaining vision centers. These are vision centers that can provide a comprehensive eye exam, referrals for other eye health issues such as cataracts, glaucoma, or similar conditions, and make affordable eyeglasses available in communities where there was no eye care option available before. And once these vision centers are up and running and the local personnel are fully trained in skills like providing high quality clinical care, tracking inventory and patient flow, and all the other aspects of running an optical business, OneSight steps back and serves as a supportive consultant. But we've left in place a long-term solution for the people in that community who need eye care. To date, we have almost 200 vision centers all over the world across Africa, Asia, and the United States, providing access to more than 40 million people. And I can tell you these numbers continue to grow as we expand these centers. So here's a clearer depiction of our footprint around the world. We're very proud of being able to go from no centers to access to so many people in just 7 years. But this map also helps keep us humble. We have a ways to go before the vision gap is closed, but we're very optimistic about that journey. So how do we know that these centers are making the impact that we intend? Well, it goes back to the 3 A's that I mentioned earlier: awareness, access, and affordability. We do surveys to ensure that what we're doing is sufficiently addressing these 3 root causes. We believe that these data-based metrics are important to truly measure our progress and identify opportunities for future improvements. And finally, we change hearts through the power of our programming. Whether it's a volunteer in a clinic, or a sponsor, or even our donors who make the choice to support our work here and abroad, all that from a simple pair of glasses. Now, I'd actually like to give you a glimpse into the power of that simple pair of glasses. I'd like to share a story from our clinic in Lota, Chile, and it features Veronica and her husband, Jose, a construction worker, who have 3 children under the age of 3. They came to the OneSight clinic in hopes of getting help for Veronica.
Veronica had not had glasses for a very long time. I'm not even sure if she had ever had glasses before. Her prescription, for those who are familiar, was -15 for nearsightedness and -2.25 for astigmatism. She would not be able to get anything into focus at all, but the best vision she would have would be anything that would be about 3 inches from her face. We had her husband, Jose, sit in a chair with her daughter about 10 feet away from her. And then we had her put on a trial frame pair of glasses so that she can see the vision that she'd been missing, being able to see her husband and her daughter in focus for the first time. Her jaw dropped and she is just full of uttermost joy. I'll never forget watching her change the baby's diaper. She had to be within that 3-inch window because she couldn't see anything beyond that. She literally could barely find the diaper in her diaper bag. And it was then Dr. Dave who said, look, I think her husband needs a prescription as well. He wasn't in line to get glasses that day, and sure enough, his prescription was a -9. And so they both were walking around in the world blindly. And I think the impact that OneSight has made for them, not only them, but many others, is something that we'll never really be able to comprehend. Thanks for all that you do.
She's like, look at me.
course, changing hearts can't happen with our work alone. We have a wide network of partners who help us, from retailers who help to staff our clinics, the corporate sponsors who help fund our work, to other nonprofits and NGOs. We're all working toward the same ultimate goal, is to ensure that everyone everywhere has the ability to get an eye exam or a pair of glasses when and where they need them. It's a big goal, but we believe that this is a solvable problem. And with the right approaches and the right partners, we believe we can get there.